like to welcome each and every last one of you for coming to yet another broadcast from CGI, Ask a DBH Conversations with Dr. Baldwin. And tonight we're going to be discussing a very controversial topic that's sweeping the land and causing a lot of controversy in the medical field and socially and politically, the Roe versus Wade decision. So the headliner of our conversation tonight is Roe versus Wade decision. Where do we go from here? And I have a stellar cast here. We're going to go ahead and get started in this conversation because it's blazing all over the country right now. We'll begin our discussion, and feel free to just chime in as we usually do as we explore these particular points that we're trying to really explore as we deal with this controversial issue. The question that I want to ask, the first one is, how can healthcare professionals be active agents in the post-Roe versus Wade decision within their communities?
I think as a man, I want to start out by saying that it would be remiss to say that this is only an issue that's important to women. It should be equally important to men. A lot of times, we get a little confused when we say, "Oh, this is about women, so women should raise their voice." And I believe that they should. They should have the loudest voice in this conversation, because at the end of the day, it's about reproductive rights and about women having control over their own agency over their own bodies and their own medical decisions. But it would be remiss of us as men not to join in that chorus and speak loudly to the fact that should be the case. We shouldn't have folks, primarily men, because of how our Supreme Court, as well as our Congress, our Congress is constituted. People making these kinds of decisions. So, with that being said, I have a lot more to say, but I'll defer to my colleagues here before I chime in. But I do want all of my women colleagues here on this panel to understand that it is equally important to me. And it doesn't matter whether I have a daughter or a wife or, and obviously, God rest her soul, my mother's passed, but it shouldn't matter whether I have a female in my life to say, oh, this is important to me. It's equally important. And I just wanted to start out with that. So.
Okay. All right. Hey, listen, Sean, you know how I saw this probably the first podcast that we had that there was a pause when asking the question. And, as men, we're trying to really, as clinicians, just really give room. Is like, how do we approach this? I know initially we were probably just go ahead and start talking, dive in, but it's such a controversial topic. So I appreciate that piece there. And I'm going to pass this question along to everyone else here. Please chime in. We got the male perspective so far in there.
It's also very fresh, Dr. Baldwin. It's so very new, this decision. But I think we should stay abreast of what's going on in our individual states. Of course, like in the state of Texas, I think it was 6 weeks before you couldn't have an abortion after 6 weeks, but after those 30 days pass, it's at the moment of conception that you cannot have that abortion. So just staying abreast on information and alternatives, because of course we have to listen to our clients' goals and what they really want, and support them in that, validate them. But like some of those other options, like making sure you have a pregnancy test at home. Of course, at the top of the list, playing the condoms, right? We're supposed to use condoms. Things like a Plan B or an Ella pill, something new I just learned, because I am trying to stay up on the up and up, that there are abortion pills and actual clinics that help with that. A place called Plan C and AID, I think it's called AID organization, who helps with that. I did not know that was a thing. I don't know. What do y'all think about that? That's new to me. The abortion pills. Anyone else ever hear about that?
Yeah, I actually had.
Okay.
I heard about it prior to this, and just kind of actually agreeing with what you said, Ray. We all need to stay abreast on the changes, and then the fact that each individual state has so many different trigger laws. Like I'm in Louisiana, and it's still being kind of sparsed out, fought out about, is that trigger law going to be able to go into effect? And how does that in turn instantly affect patients all across Louisiana? I specialize in addiction. So a lot of times my patients will not know they're pregnant, maybe sometimes at least until 4 or 5 months. And sometimes the average woman won't even know until about 8 to 10 weeks. So laws that instantly say, well, at the moment of conception, you're not given an option at that point. And so helping them to understand how this could possibly affect just our levels of poverty, social determinants of health all across is really important. And having those individual conversations with patients and saying, what does this look like for you? Do you already have children? How will having another child affect your reality? And what can we do to try and prevent that? But we also need to realize, like you said, there's going to have to be times when there's a plan B or a plan C. So it really needs to be discussed, and it needs to be a part of patient care planning on day one.
I definitely agree with both of you ladies. I think we have to come to agreement that our states and sometimes different cities have different rules, different laws, different people who may help in different ways. And so I think our role can be very beneficial when it comes to making sure that our clients, specifically our female clients, our clients who can reproduce, are going to the doctor regularly. So if you know you are actively having sex, you are not using protection, go and check that out. Let's not come to therapy for months on end and say, oh, I wasn't feeling well, I threw up. And then here we are pregnant and you weren't looking to have a baby. So for those women who are looking to have babies, for women who are not, and then on the other end, for men who, maybe weren't ready to have a child, I think we have to have those tough conversations. Well, what are you doing where a child can be produced, and how can we be more safe if you want to continue to have sex? I mean, we're all grown here, so if you want to continue to have sex, how can we make sure that you are more educated on the rights that you have, and then also you're protecting not only yourself but your partner as well. So just having those tough conversations. I know a lot of times the younger we are, the harder it is to talk about having sex, especially unprotected sex. But then once the baby is here, once the baby is conceived, here's the point where you have to tell someone. So I think for us being the professionals, we definitely have to be educated so that we can educate other people, as well as being compassionate, because there's a lot of people out there who may end up in situations that they never thought they would have been in due to the overturn. So we just kind of have to be gentle to that and understand that our clients are people too, and helping them where it doesn't affect our license, helping them where it doesn't affect our integrity, but where it also helps the client to get exactly what they need and what they want.
Absolutely. I agree with you 100%. And being active change agents, there's so many different avenues that we can be involved in. The one thing I've been keeping my eye on is pretty much the Planned Parenthood perspective of things, of how we can take action. There's so many different other ways that you can take action, and so, being involved as change agents is, I definitely see us collaborating as DBHs with organizations that are really on the front line. There's so many different ways to be a part of a movement to address such a controversial issues that are affecting women, period. And so we'll talk a little bit more about that at the end of just different resources and different ways that we can take action and steps. Anyone else would like to chime in on this particular question? The question again was basically focused on how can healthcare professionals be active change agents in the post-Roe versus Wade decision within the communities?
Yeah, I would like to add to that. So I live in California. However, I do have clients that come here all the time, and they move from out of state. And a lot of the times they come here so that they can receive developmental disability services. And there is an ethical dilemma with the field that I work with, and that's if whether or not families should have the option to choose if they want to bring a child into this world with a disability or a genetic disorder, given that we can do those tests nowadays. So this post-Roe v. Wade decision brings to light the gaps in care for children with disabilities. We have foster parents, adoptive parents, caregivers. They all come to us and they don't have the proper resources to support them. And that's something we want to look at as change agents. These children, they grow up to be of childbearing age. People forget that individuals with developmental disabilities procreate. And they forget about that. And access to sex education or self-determination supports are very limited, especially for underserved communities. Some may have co-occurring conditions that put them at risk for getting pregnant. So me personally, I just had a child and I'm a Filipino woman and I am an educated Filipino woman. And even I had trouble accessing care during my at-risk pregnancy. So all the more, I think, for people who have a disability, who may be a minority, who may be underprivileged, would have difficulty accessing care. And to be that change agent, I think we as professionals have to educate ourselves and how to provide supports for these families. And this includes being able to provide that person-centered model of care that supports the individuals based off of their intersectionality. So that includes their socioeconomic backgrounds, their education, their ethnicity, and their disability across their lifespan.
Okay, thank you for sharing that. That's a great perspective, and very glad that you pointed those things out. Period. All right, we're going to move on to the next question here. A legislative change of this magnitude can feel very overwhelming, even as a healthcare professional. What is one small action or mindset someone can take today to become active or more active in the conversation and in the community?
I could go first with that one. I would say becoming educated on the law and the reason why it was so important in the first place. Important in the first place for it to happen. And then learning or being aware of your own implicit bias as a provider that you may have to the conversation about abortions.
Very much so. I typically pay attention to a lot of state laws about different other things, but this has made me really see how different, each state operates. Period about this particular issue. So, my thing is, how is it looking in other states? There's some states that are supporting it, and some states who are like in the middle, and some people who are just, totally against it. So just a lot of controversy. This thing is very hot. This is causing a whelm of emotion. I don't care what platform you're in. I've seen as far as celebrities, everyday people, talk shows, different things, newspapers, social media, because such a controversial piece when it comes to policing women's bodies and dealing with their choice about as far as life is concerned. So what are some other things like another one small action or mindset someone could take today to become more active or in the conversation in the community?
This has been a huge political sea change, 50 years in the making. And I think Jeny referred to the social determinants of health. And so we have to look at the broader perspective of how all of these little pieces fit together. But it is also said that all politics are local, as we all mentioned here. People are from different different areas. And so a lot of times it's difficult to get the communities that are affected by the social determinants of health mobilized in interim and midterm elections, right? And so what has happened over the last 50 years is that there's been a drift towards conservative politics at the state level. And so what has happened, that has had the cumulative effect of now making this sea change possible. So what does this all mean for us as DBHers who are also change agents? We have to advocate and mobilize communities to take part in their local politics and interim elections, right? So that we can switch that, so that we can start slowly making that, turning this around. Because what will ultimately happen, as I hope, the backlash from what this will happen is that it will create a sense of urgency on the part of communities of color, of marginalized folks, because if we don't advocate and educate our communities to mobilize politically, then it will ultimately have effect on not only just their reproductive rights, but the other rights as well, and other kinds of healthcare rights. So I think as DBHers, we have to educate, and I think Jerrika talked about this a little bit as well. On the front end, we want to educate people about choices and making choices and giving them good information about how to make those choices. And then on the more macro level, as Jeny referenced, we really do have to understand that people's health outcomes are inextricably tied to the social determinants of health, and we change that. We can only change that through political action. So, yeah. So.
Hey, great point there. Great point there. And speaking about the overwhelm piece, I think this is out of all of my career, this is the first time, because I have colleagues, medical doctors in the field who are, actually practicing and different other things. And I've never seen them so upset and overwhelmed by a decision of such. It's a very touchy issue. I've had conversations to come up, where some of my colleagues were violated. This decision has really triggered some unresolved trauma that's happened, and I've never experienced anything like that with, because people who are functioning and moving and achieving and in certain heights, or it just never seen them just in awestruck. And the fact is, this decision caused them to revisit that trauma. Some of them have been in positions where they were violated and became pregnant, and they are revisiting that trauma, like, what if now, it's like, if that happens, now, like, what happens, just in general, to the, generally concerned about the well-being of other women. You mean to tell me I don't have a right, to decide if something as traumatic as that has happened to me, that I cannot choose? Very overwhelming with this decision. So that's been my experience. And then hearing different women in my family, certain situations who have been in traumatized situations, such as molestation or rape. Very common. It happens more than others, to see them revisit that. I don't think I've seen as many women in my family upset about a situation collectively. They're upset about other different stuff like that. They had nothing but a collective issue where the common denominator is that they're women and they've had their experiences, whether it's good or bad, to see them revisiting and being really emotionally affected by this, like they don't matter, was very disturbing to me. So one of the reasons why I want to have this conversation with you all, because I'm processing with you guys what I've experienced so far with this type of decision. So again, to pose this question before we move forward, is there any other small action or mind state that someone could take today to become active? Women, I can know of one. I answer my question. I'm supposed to add this as far as seeking counseling, because all the folk, what I've done so far, because I realize it's trauma, because as clinicians, we're in our medical facilities, we're in our traditional outpatient, we're in our specialized, we're in our communities, providing psychotherapy. I think it's a good situation or pathway to introduce counseling and therapy to folk who are processing this. Like I said, you don't know what underlying or issue or trauma or depression that this is bringing on. Believe me, it is bringing it on. So one thing we can continue to advocate, really, I heard you mention before about, removing the stigma as far as dealing with this, but to really seek some counseling and support from a healthcare professional, a licensed therapist, to deal with the impact of this decision. I have a patient that's seeing me now, and actually, it's a male, and he's telling me how it's impacted his family. As far as that decision, I was like, wow, so it's not just affecting women, it's affecting men who have families, who have to deal with this situation and then make decisions about, well, we were planning on having a baby, but what if, the baby is, is different between, my wife and my baby, which one, it's just basic human, survival at this point. So counseling and therapy is needed by many. So I could see us as DBH is providing that psychotherapy and ensuring as a community to continue normalizing getting some counseling and some therapy.
Not the Baldwin, you took mine, but
I took that. No. Go ahead. No, you got your own. Press on it. No,
yes. Just to kind of piggyback on what you said, it is an actual great time to introduce therapy to communities that normally will not have that discussion, will not have those talks. As disruptors in healthcare, it doesn't always mean doing things that are super radical. It can oftentimes just mean having a conversation that 10 years ago may not have been had. Just being able to come and say, hey, this has triggered me in this way. Any advice on what I can do? Yes, here goes a list of some therapists I think would be great for you to see, to have that conversation with. And like you said, it can also be for men. It's not just, like you and Sean said, it's not just about women. It can be about anything that has tied that for you to be so significant. So my little action is have the conversation. Use your voice in any way that you possibly can to support either side. We're not saying that you have to be pro-life or pro-choice, but whatever you are, use your voice to make sure that you're making some action.
Yeah, so there's so many different levels. That's a great comment. Yes. There's so many different levels to get involved, as far as with the movement, you don't necessarily have to be the person out there carrying the flag or marching, protesting. There's so many different ways you can support it as far as that movement in general. So thank you for sharing that. Definitely. Thank you.
Yeah.
All right. We're going to move on to our next question. As therapists and providers yourself, is likely or has already surfaced that you will be or treating patients who was triggered by the Roe versus Wade decision. What has that experience been like? Have any of you experienced anything of that nature? Because more likely they're coming if you haven't.
So remember I said earlier that it is very early in this. So I have heard a handful of women mention it, but these women are taking preventative measures. But no, I have not heard no one who supports taking this away. Like nobody has said, oh, yes, that's great, that happened. The people who are talking about it feel violated. I haven't heard any men talk about it yet, but the women, there are a few women that are talking about it, but no one's been actually impacted. So I think when I see the impact, they're going to come into therapy for what they want to come in therapy for. And so right now, that's not the big conversation, but it's coming.
Oh, it's definitely coming. And like I said, the fact that I had a patient myself and it was a male, I was like, how are we going to address this? So it is coming. So as therapists, as DBHs, how do we prepare for this? I definitely agree with, the education piece that was, being aware the different things that come along as far as, diagnosis. We don't know what type of exacerbation, even this, from that it will have on people's mental health. And I'm quite sure there's a lot of stories that have not surfaced about what has happened with this decision on the mental health of folk. I do know so far there was some relived trauma as period. I've never seen collective trauma unless something big detrimental, like we've experienced in the last couple of years with police killings and all different things where the masses are affected. Everyone, but this is something, as far as affecting, women, all over the world. I mean, excuse me, in the U.S. And I've seen people protesting in the streets. Just a lot of a collaboration of different organizations that are addressing this. So a lot of those people are experiencing a lot of stress and anxiety, and like I said, relived trauma and depressive symptoms due to this decision. So as therapists, like, hey, we gotta, as DBHs, we got to be prepared for to create systems and support groups and be prepared for this oncoming piece, because even it's going to be a long hill battle before this thing is ever resolved. So I think this will be a part of our careers. This will be a decision part of our careers, no different than, police killings and different other things. This is just this particular issue is going to bring a conversation. Go ahead, Sean.
I was going to say, I was just kind of dovetailing on what you were talking about in terms of collective trauma. It drew a smile from me because I'm about to do a presentation on the collective trauma of COVID. In addition to, like you mentioned, the police brutality and the things that we've witnessed over the past few years, that kind of concurrent with the advent of COVID, we all globally, not just here in the United States, experience this kind of collective trauma. And the collective trauma of having a right taken away. I think someone suggested, and I have to confirm it, that, this is the first time that the Supreme Court has reversed a right that was previously given. Typically, with amendments and other kinds of decisions by the Supreme Court, it extends rights. We don't necessarily think of the Supreme Court as reversing or taking away something that people have enjoyed as a right for years. And so it will have sort of an immediate effect as it's having now, but like you said, a sort of delayed effect. And so we, as mental health providers and DBHs, we have to prepare for the eventual onslaught of how that might happen. Now, we understand and we know that everybody doesn't sit on the same political spectrum and maybe view the notion of abortion in the same way. However, that being said, it will invariably have a collective effect, because no matter what side you're on, if you're on the side that don't support that right being taken away, then just dealing with the mental trauma of that and being in a position where you have to go to another state or go underground, God forbid, and put yourself and your life at risk, or you're on the side of those who maybe embrace the decision, and yet the reverberating effects that it can have in terms of other people and with whom you interact. So it's going to have an effect one way or the other, both individually and collectively. And so it's our, as people, as agents, change agents, as we like to say, we need to see ourselves as being in the middle of that, helping people to understand how it impacts them, helping them to understand what agency they have in terms of making a difference. So I think we do. I think to your point, though, I think that it just like it took 50 years for different things to happen to chip away and put in place the structures that were able to turn this around. It's going to take that same long game approach, for communities to recognize, not to take for granted things that could be taken away depending on how the wind blows.
Yeah, and I could think we'll start seeing a lot of cases of parents, young parents, and middle-aged folk who are contemplating on creating families. I think we'll start seeing more of that in our perspectives where, the decision-making process of, we're trying to have a child, but, the what ifs, which can create controversy between, as far as family is concerned. I just see just a matrix with this decision and how that it not only impact women, but also the nucleus of a family as well in the decision-making process of creating life together. So I just see this as years to come.
I wanted to kind of jump in, and Sean mentioned something about, what side we sit on. And obviously nobody's just out here saying I support or I don't support, or it's easier to say, I cannot stand that this has been overturned and how could they and why would they? But then we always have to know that there's someone on the other side, whether they, openly admit it or not. So when the question asks, have we seen people or have we talked to people who are triggered? Up until right now, in my head, I only thought that the people who were triggered by it were the people whose rights were taken away, or the people who were, that they no longer had that choice. But looking at it from the other side, it's also people that are triggered by the fact that people are upset because this is now a thing. Women have had their rights taken away in this manner. And it's almost disheartening that we have people in the world that are triggered by the fact that women are not able to make decisions for themselves. So not only I think about when I'm taking in clients or I'm seeing parents and parents with children, they're so sad because they know that it's somebody out there who doesn't believe that they're valuable enough to make a decision for themselves. And so when we talk about educating our clients or educating ourselves, educating people in the world, we have to look at, prior to this, people would lay down, have sex if a baby came, but now we have to think about, what are my genetics like? What are your genetics like? Do I see myself being with you for 18 years? Because it's so easy to say, I'll handle it, or you going on child support. But now we have to, I don't even have some of the options that I had, and I'm forced to live this life based off of a decision. So kind of circling back, I didn't get to answer the question, what is something that we can do? I'm actually taking a class right now to be a perinatal educator. And I don't know if you all know what that is, but basically what it is, it's a person who supports women who can become, or women who become pregnant to cope with pregnancy, childbirth, postpartum, and early parenthood. Mm-hmm. So that's a process. It's so many women who get pregnant, and we always talk about postpartum. What about the pre? What about before they get pregnant? What about while they're pregnant? So educating them on their rights, educating them on what pregnancy looks like right now, and being a support system for not just them, but the family, the person they chose to have a baby with. Do they have other children? Mm-hmm. How will everybody be affected by this? The grandparents, it's so much more than just the childbirthing mom. We have to think about it. It's a world full of people who are affected by things. And I think we're doing this podcast and we're bringing awareness to the situation at hand, but it's so taboo for somebody to actually raise their hand and say, I agree or I disagree, because we don't want to be that person that is the opposite of everybody else. So we're talking about rules, laws, and regulations, but what's actually right? I saw a post, and here I am bringing social media in it. This is the millennial in me, but I saw a post and it said, yay, no abortions anymore. And then a daughter came in and said, hey, Dad, I'm pregnant. And it wasn't by someone that looked like them. And they said, wow. Oh, no, we're going to find a way to get rid of it. And so that's just true life. When people don't look the same, or when they look different, we want to handle it, or we don't think it's valuable enough. Wow. So we have to forget that's a woman, that's a man. what does my heart say? And I'm kind of getting off topic here, but people are valuable, whether we want to believe it, whether they want to believe it, and our bodies matter. And for me, it's very disheartening that we have to sit here and have this conversation, and that it is a trending topic, because this is something that never in a million years would I think some people have thought that they would have had to fight for the opportunity to have or not have a baby, especially go through a pregnancy that may end before it's due, if that makes sense. We don't want to have to, like you said, you have a client. We don't want to have to decide who gets to live and who gets to die, or what if child comes and things are out of our control. I think that we should take into consideration that lives matter and we deserve to make our own decisions. And with that being said, we deserve adequate counseling and therapy services and providers across the board that care enough about us to listen to us. So.
A great point there. A very interesting. I'm sorry. Go ahead, Sean.
You know, Jerrika made me think of something that she it's like that. The whole notion of Black Lives Matter. Oftentimes people will react to that kind of notion because when people say Black Lives Matter, they think that means that other lives don't. And Jerrika was mentioning something, and she said that, and I'm just kind of creating a phraseology based on what she said, that women's bodies matter. That women's bodies and having agency over their body doesn't mean that an unborn life isn't important, but it's just casting some perspective about it. And that if you are a woman and your faith or your belief tells you that I don't embrace abortions, that's fine for you. You get to have the decision not to do that. But to take away the decision from a woman who may not have that same disposition or thinking, it just seems anathema to me. So it just made me think of that. But go ahead, Doc. I just had that thought as Jerrika was talking about that. It made me think that, why take the agency away from women? Regardless of where they stand or what they believe, they should always have that agency. So,
absolutely. Thank you for pointing it out, Sean. And it makes me think of a conversation that I had with our CEO, Dr. Kara English, who's very heavily involved as far as dealing with maternal health. The thing that she pointed out to me, was in a conversation that the United States women face the highest maternal mortality rate of any high resource country. And we are like the only country outside of like Afghanistan and Sudan where the rate is rising. This means that in the US, women have the highest rate of death among all other high income countries. And Black women are nationally 3 times more likely to die from pregnancy and childbirth related complications than are white women. And in some states, that statistic is as high as 7 times higher. So just this is very robust. It has to do with women, but there's some people even within the as far as within women that are more subject to have a even deeper impact than just the surface. So this thing is very broad.
And to look at that also, Dr. Baldwin, I was reading the statistics on that, and it's not really based on your socioeconomic status. There's rich women that are dying, during childbirth. Black women, as we know, are more susceptible to that, but it's also Black women who have who are rich, who have high economic, and there's a documentary on Hulu right now about something like that. I'm not sure I can't remember the name of it, but it's basically going through, and especially here in Louisiana, we have a very high Black mortality rate. So it's for pregnant women. And when we think about that, it definitely what Jerrika said, it makes women feel like their bodies do not matter, their lives do not matter, because you're telling me no matter what, I need to put myself in a position, because even if you're not in a high risk pregnancy, you can still pass away, you can still have many things happen to you. So it just really makes it feel like we're just here to put people on earth, and other than that, that's just what we're here for. So it does make us feel like sometimes our lives particularly just do not matter.
Wow.
Jeny, when you talk about the income, sort of controlling for income, I would be willing to bet, or at least I'd be curious to see if you stratify that income and race, so that, in other words, we know that people with higher incomes are going to be able to, as Jerrika was pointing out, if they need to,
they can access in other ways. Yes.
Right. But when it comes to sort of the maternal health of Black women vis-a-vis white women, for instance, we know that there's studies that show that medical professionals typically don't acknowledge Black women's pain vis-a-vis their white counterparts. So even if you're a high-income Black woman, when you encounter medical professionals, you're going to be not your reports, your complaints are not going to be taken as seriously and addressed as thoroughly as it would with your white counterpart, irrespective of your income. And so that's, I think, an important factor, and it goes, to the heart of why we have to be always on the forefront of advocating for equity in healthcare as it relates to people of color and certainly marginalized people. And so, you have both of those groups that have to be considered. So,
okay.
And I just want to point out real quick, I don't have any children. So, of course, I don't 100% know. But what I do hear a lot is, women in general, specifically Black women, are going to the hospital. They're having these babies. And they're, like Sean said, their pain doesn't matter, or it's not being taken as serious as it should. But here in these past couple of years, we've seen more women do home births, natural births, use doulas and midwives. And so those are births that go unmedicated and without, what are they called? You put them in the spine?
Epidural.
Epidural, there we go.
Yeah.
And they aren't using epidural. So it's saying that it can be done if you have the right providers on your team. If you have someone that's going to take your health and your baby's health serious. So, I mean, of course, we want a healthy baby. Of course, we all do. We want a baby.
Right.
But it takes the woman pushing out the baby to stay safe and stay healthy during that process. And so I think in whatever the situation is, when a person in general is more calm, they're more relaxed, and they have on their team that they know they can trust, the experience in itself is better. They have it takes less time to recover. They typically don't have postpartum depression because they have a team that cares for them even after the birth. And so I think when women who have babies go into the hospital, it's all about a job. We're going to push the baby out. They're coming to catch the baby, check the baby, and we're leaving, when they check us out. But in your safe environment, in your home with your team who you got to hand pick, that with or without the medication, they're going to be there to support you, to guide you, to help you, and to make sure that everything is as safe as possible. And so I think that's really what we're all trying to say here. From conception to birth to after birth to breastfeeding to watching the child grow, the main goal is to make sure that the people who are birthing these babies remain safe, make sure that these babies are born safe and can live in a safe world. And right now, it just really feels like not only with this situation, but other things as well, we as Black people have not been shown safety in the world. And I talk about this all the time. We cannot expect people who don't look like us to treat us better than we are willing to treat ourselves. So I live in Memphis. We kind of talked about that. And I hear all the time, they don't treat us right. They don't want to fix our area, but how could they, or why would they, when we are the ones that are tearing it down? And I say we, because I look just like the people who are going and doing these shootings or going and stealing and going and doing all these things. And so when it comes to something as serious as carrying a baby for 9 months, birthing this child, literally putting my life on the line, they think that it doesn't matter because I have people who look like me that don't care if my house is getting broken in, or don't care if, they go in and steal from the stores that we only have to shop at. And it's sad to know that we can expect more from other people than we're willing to give people who look like us. So I think when we can come together, when people who look like us can come together, we'll be able to demand more respect. We'll have people who look like us get in higher places to demand better justice for people who look like us. And it takes everybody.
Jerrika, back a little bit. I think the respect starts with us respecting ourselves and each other. But we're not ready for that conversation yet.
Right. That's a different podcast.
Okay. So we know what's coming up in this series. So definitely, I'll be reaching out, and we're going to cross that river as well. Going to cross that river.
Dr. Baldwin, there was one thing I wanted to touch on. I saw a story yesterday and I started talking about it with my intern. It was about a lady, I can't remember what state she was in. She miscarried and the provider refused to perform the DNC. So she had miscarried. This was after the law I cannot remember what state. And she spent 2 weeks trying to find a provider to perform this DNC. Meanwhile, she had miscarried her baby and they would not do the procedure. So we're happening with the 10-year-old child. And I haven't gotten a whole lot of information on my own about that. So I don't want to, touch on that. So there's all these different things that we're already seeing the spill outs. And then how are we supposed to help these people, these patients and women and girls process what they're going through? Because pregnancy and carrying a baby is already something that's traumatic on the body.
So I heard a similar story, or I've read a similar story. This woman, she miscarried as well, but her provider couldn't do the procedure right away and needed a second opinion, which I think would be a way to protect herself as far as, when lawyers come in and look at evidence. So they needed, I think, a second and third opinion. So the woman who miscarried had to carry her lack of a better word, her dead baby in her womb, as she had to hear the provider say, "I'm sorry, you've lost your child," a second and a third time. And that's actually another thing that came to mind. I'm not a counselor, but you all are. And I think there is also services that will be needed by providers. I think, doctors themselves will get triggered. There's going to be counseling that's required for them to learn how to speak to their patients that are dealing with these issues and these limitations and the options that they have. And I think that adds to the burnout that we've seen this past 2020. Right. We know our nurses or doctors are all burnt out because of the pandemic, and now we're having this and putting them through this as well, of fear of losing their license, having that dilemma between doing no harm versus waiting to see if am I following the law.
Okay, good deal. Thank you for sharing that. Right. The other question that I have, what advice do you have for other mental health professionals who are and will treat, for us as clinicians? What advice would you give us as we begin to, take on this trauma, of trying to treat the patients of this particular standpoint? One thing that I can definitely encourage as far as us as providers, definitely to really invest in some self-care, because you're going to get an influx. Even though we're dealing with a lot with trauma and we're overwhelmed, you're going to get an influx of a whole nother conversation of trauma people, other than that is going to be overwhelming. And then we know that there's only a few of us. So a lot of self-care ensuring and certain that in your lifestyle in order to preserve yourself as a provider in the field, like you spoke about as far as the burnout. I'm looking for advice from me. and how would you advise me, and your other fellow colleagues as DBH experts, what advice would you give us?
My advice would be to be honest with yourself, be honest about your beliefs. And if you feel a certain way and you don't feel like you can continue to see certain patients or take on certain patients because of that trauma, that's okay. You are still a human. You still have your own beliefs, thoughts, and traumas that you've experienced. So you don't want to experience any common transference and end up, re-traumatizing yourself continually, or even, even if it wasn't personally to you, it could have been to someone in your family that you're very close to. If this would just be too much for you to take on, that is okay. And be honest with yourself about that and just get you a good referral list like you would with any other situation that may be going on, that you're just like, I cannot take on these patients because I feel strongly this way or I feel strongly that way, and I'll be more detrimental to them and more detrimental to myself. So have that honest conversation with yourself.
I appreciate you for saying that because, we as DBHs and DBH clinicians, we're definitely consider ourselves superhuman at times.
Yes.
And we're going to take on any and everything that's happening of anything mental health that's exacerbating any medical conditions, period. And we're going to take on everything. But, when there's a statement I always say, we're so good at helping other people, but who helps the strong, we're being strong and being there, but who helps the strong people?
Who helps to help, right?
Right.
Who helps to help?
Right.
Yeah.
We're forgotten in this equation.
We forget ourselves. There's the notion that hurting people hurt others. And sometimes we may be hurting and not be aware of it and still inadvertently hurt others. And I say you turn that around, and healing people can help others to heal. So if you're taking care of you, you can help take care of others. And I think, Jeny's spot on. I think a lot of times, and you're right too, Dr. Baldwin, you say that, I think mental health professionals in general are some of the worst perpetrators of self in terms of not engaging in self-care. We have to be.
He said it. We
responsible people, right? And by extension, DBHers probably think they have to be all things to all people at all times, and that's just not possible. So that honesty that Jeny talked about is the first step, and recognizing when to say no, or what can't I do, what do I need to pass off to others. And then once we do that and we realize what we can do, we're on the road to the right track. We're on the right track, I should say.
Okay, thank you.
My video, I'll pass it over to my colleagues.
Oh, you're fine. That's a powerful comment. Thank you for that advice. Does anyone else have any advice?
Yes.
Or words of encouragement, something. Help a brother out. Yeah.
So I definitely love what Jeny said, because I love a good referral list. If I cannot handle it, if this is going to be too much, if we don't, mesh.
Referral list or self-care.
Yes. So. Yes. So, but on the other end, I say this is going to be a long road, regardless of what we believe, what our clients believe. And I say, if you do choose to take on clients who are struggling on either end, I think you have to be honest with yourself. And if you choose to take on these clients, don't let your belief get in the way of what they believe if it differs. And even if it is the same, I would say, I'm not going to put my thoughts in my client's mind. So my client is leading the session. And so we just have to make sure that we are providing the best support and care for them while they are choosing to come and share space with us. And so that looks like me making sure I have resources for them, whatever they look like, making sure that I'm allowing them space to just come and be and breathe. So if we choose to see these clients, because as we know, we don't all specialize in everything. We don't have to do it. But if we choose to see these clients, we have to be upfront about what we can and cannot handle and let them lead the way.
Okay, good deal, good deal. Lastly, the question I had, like, can you name any, like, one resource healthcare professionals could bookmark, or something you found personally that that's helpful to our profession, since the Roe versus Wade decision? I know for one thing that what I mentioned, resource, as far as healthcare professionals, at times it's like getting involved in other things, even outside of your, as clinicians, just like, okay, socially. I had a good conversation with, again, I had these real heart-to-heart conversations with our CEO, who is a strong advocate for health equity, period, across the board. A couple of things that she pointed out to me that stood out is like, as doctors of behavioral health, we all have the ability to see, like, what she calls the 80,000 foot view, identify the moving parts and seeing the connections as like no human can. Your voices belong in, like, policy reform or decision-making boards and committees, and in thought leaders positions in your communities. We have a responsibility to advocate for the healthcare and human rights of all community members. So there's different resources. You can get involved in any social justice piece outside of your medical profession. One that pointed out to me was, I was like, okay, when I was speaking about the Planned Parenthood piece, which I never, be honest with you, I never looked at Planned Parenthood in my career, and I was going through. That's a good resource that can advise, even outside of us treating, about us being a part of all these different other capacities, like I mentioned, that Dr. English mentioned to me, like, how can we get involved? And the one thing about the Planned Parenthood piece, you can make donations to, like, your local Planned Parenthood. You can help support independent clinics. Sharing resources for people who may need abortions. There's like, abortion is still legal in many states. So there's like abortionfinder.org that can help people find, like, the nearest person to them, and the National Network of Abortion Funds, which has more information about local resources that can help with travel and other logistics. Another way is speaking up. Even though nearly 1 to 4 women in the United States will have an abortion, by the time they're 45 years old, people don't talk about it. But silence and stigmas are weapons that lawmakers use to take away our rights. So we need to tell our stories about why abortion access is important. And then there's parts of where you can take it to the streets. There's websites like BANSOFF, which is BANSOFF.org, or text access, ACCESS, to 22422 to get more information about events that's closer to you. So that's like one avenue, a resource. Another, I'm quite sure you all have different other community resources, mental health agencies, social justice agencies that are in your community. So definitely feel free to send me those links if that we can definitely share with our audience. And I would definitely appreciate that. We'll make sure we get that information out. So that's one thing, like I said, resource we can definitely use. And again, in my conversation with Dr. English, she processed to us as DBHs that, she knew, that we may feel kind of panic or triggered or terrified, or even disgusted with more in the light of the decision that was made. She was explaining that she finds it difficult to focus and even hard for to find any shred of hope for the U.S. as a domestic democratic nation. I mean, she's very, I would say, done with this situation and very upset and angry. And we go process that together. And she wanted to let you guys know that she wanted to encourage those of you who have been closely watching and worried about the decision to do anything you can to turn off the news and social media, at times, in order to step back and re-engage, because it's traumatizing. And be able to, as DBH, just really, just tap into, more of the self-care and engaging in different other aspects of trying to be involved in this movement. So I just wanted to point out those few things to you out of our many conversations Dr. English and I have had, and we will discuss this in our curriculum. This will be a lifelong thing that will follow us along with this pandemic for a long time, Dr.
Baldwin, I wanted to add that I don't know about everyone else, but it meant a lot to me that day Dr. Janet Cummins did send out the email, encouraging us that this is a part of what we will be able to help patients with and the changes that we will be able to make. Mm-hmm. So I would say surround yourself in people who want to support whatever you are supporting. Sometimes I feel like with social media, we often end up in these little arguments with people. It's okay to surround yourself with people who share that belief that you have and will encourage you to take care of yourself through this time. So that's very important.
Yeah,
absolutely. So I'm glad that Dr. Cummins is that when she sent that email, that she pointed to a resource. That
made everything a little lighter.
I would have never got involved in it like that. Like, hey, this is where this is where you go. This is where you go.
Well, it's great to know. It gives you the confidence that you're around people who care. Who care about impacting people's lives for the positive. And, when you're talking about Dr. English and sort of disillusionment that, with what's going on with the state of affairs here in our country today, it makes sense. It's kind of like you're going at top speed, let's say 80, 90 miles an hour down the road in a car, and then all of a sudden somebody slams on brake. And it's just like, that's going to shake you up. That's going to reorient everything that you thought was happening because you were moving in a direction. This decision is like total reversal. And it doesn't matter politically where you stand. It just means that as a country, as a society, we were moving in one direction, and now all signs point as if we're moving in the opposite direction. That's a hard thing for people to get their head around. Mm-hmm. And so you think about what we do and who we are, as change agents. We often talk about, and this kind of brings in the notion of self-care too, work-life balance. And a lot of the things that I've been looking at recently has changed that dynamic to work-life integration. I think COVID has sort of flattened the way we work and live. You can't easily just separate those things now because so many people work remotely. And so we get to see and realize and experience our lives in a flatter way. There's not this real clear dichotomy between what we, our work and what we do in our lives. Mm-hmm. And because of that, it's incumbent upon us, again, to educate the people that we work with, who we serve, about how to do that. Now, oftentimes the people we serve are going to be at the marginalized end of that. They're not going to have, in many cases, those same integration, those same integrated opportunities. But that notwithstanding, I think for us, it's important to help advocate, to be change agents, to understand that we can't separate the politics with a small p, not big, not saying what side we stand on, but the politics of the decisions that we make for healthcare from the realities of everything that we do day in and day out. And then finally, I just say that one resource is ASPR, the Assistant Secretary for Preparedness and Readiness website. It's a government website, so you plug it into Google, you find it. Endless resources in terms of what health providers can do and how they can better prepare and equip themselves, as well as resources that we can share with the patients we serve. So ASPR, is a government website, Assistant Secretary for Preparedness and Readiness. Wonderful website.
Good deal. Thank you for sharing that resource.
And then I have one more resource for any providers who are interested in working with women who are potentially expecting, plan, want to, or are, or who have recently had children, or for just people who are wanting to get more involved in the pregnancy and childbirth. So the Ladies of Hope Ministry have sponsored, they sponsor a total of 25 women, I believe it's like per semester, to take a perinatal educator course. So that's doula and a whole bunch of other things encompassed. And so if you're just interested in learning more or having something else under your belt to be able to help those women while expecting and after conceiving, they partner with Common Sense Childbirth to provide the education. And if you go on either one of those websites, they have a lot of information for women in general.
Thank you. Appreciate it. I would also like to, to throw out there resources due to the impact of this on people's mental health. As we all know, there's a new 3-digit 988 suicide and crisis lifeline that's designed to be, quickly accessible for folks who are going through a mental health crisis and everything. So definitely want to point that out as a new avenue. So it's the 988 where you could simply call or text the numbers 988 for anything of a crisis of that sense. And like I said, I think that's very important to mention. And it's very timely that that's been put out in these detrimental times. So no matter where you are, you got access to some type of support in order to help us matriculate, through this controversial issue that's really having the impact on the mental health and overall well-being of many, of thousands of millions of people. So that's I think that's a definitely good resource to put out there as well. All right. I appreciate each and every last one of you for attending this podcast. I knew this was going to be a heavy topic. I thank you for your time, your expertise, and definitely, I'm quite sure the audience will definitely appreciate, asking you as DBHs, giving guidance and assistance and resources out there as we continue to address these social issues head on. Dr. English always mentioned, yes, we are DBHs as far as working in medical facilities, different other things, but we're also change agents and activists in being involved in many platforms, policy reform, all this. That's what DBHs do. So thank you for coming. I would like to say good night. And until the next podcast of Conversations with the Good Dr. Baldwin, we will, and I can tell there's definitely going to be some more conversations coming up, addressing a lot of many issues that we're facing here in around the world, especially in the U.S. So I bid you good night, and I will see you at the next podcast.